Oh! I didn't see you all there. Welcome back to my channel. I hope you've had an amazing week. I'm Dr. Daniel Follows and this is GP Made Easy. So today we're going to be covering angina because it is a condition that if left improperly treated can have some serious complications. But before we do, don't forget to like, comment and subscribe so I know that you're enjoying this content. But anyway, let's get on with the video. So first of all, a little bit of background information. So angina is a clinical syndrome characterized by chest pain precipitated by activity that causes increased myocardial oxygen demand. And what that means is any activity that increases oxygen demand for the muscles of the heart. And it doesn't necessarily have to be physical stress, but can be emotional stress. It is predictable in onset, it is reproducible, and it is relieved by rest or GTN spray. And it is most commonly caused by narrowing of the coronary arteries, which are the arteries that supply the heart. So up here, I've got a diagram. So you can see at the top, that is what a normal artery is supposed to look like. And then down below is an artery that has been thickened either by cholesterol building up or even sort of calcium deposits can build up there as well. And as you can see, it's formed a thick plaque that has caused some narrowing of the arteries. Now, if angina is left untreated, can have some serious complications and can lead to strokes or myocardial infarctions or heart attack as we know them. It can lead to unstable angina and it can even lead to sudden cardiac death. So, risk factors for angina include smoking, if they've got diabetes, if they've got high blood pressure, if they've already got a history of coronary artery disease, if they've got a family history of coronary artery disease in first degree relatives, so their mum or dad, especially if their dad had any heart issues under 55, or their mum had any issues under 65, if they've got high cholesterol, if they've got chronic kidney disease, or if they've got signs of atherosclerotic disease, which is the narrowing of the arteries in other areas. For example, if they've had a stroke or a mini stroke, or if they have peripheral vascular disease. So, on to symptoms now. So first of all, the nature of the pain, people may describe it as a tightness, a constricting feeling, a dull feeling, or a feeling of heaviness. Or some people may just describe it as some discomfort, or some people may even just say that they feel out of breath. Now the location of the pain can either be retrosternal, which is here, or it can be towards the left side of the chest, or even some people it can radiate up the neck, into the jaw. It can sometimes go down the left shoulder and arm, or some people even say that it can go into the back as well. Most people will describe that it's brought on by activity or emotional stress, and that it is relieved by rest or by using a GTN spray if they have one. The duration of the chest pain is, once they have sat down and started to rest, it will tend to last for several minutes and then settle. Some other factors to be aware of is some people may describe it being exacerbated by the cold or if they've eaten a large meal. And with that, what tends to suggest angina is if it doesn't settle by using an antacid. So when we're classifying the chest pain, we call it typical chest pain when they have all three features of the nature, location and activity. We call it atypical chest pain when they have two of those features, and we call it non-anginal chest pain if they have one or none of those features. So for anyone that you suspect has angina, the first thing you would do is refer them to the local chest pain clinic, and you would also prescribe them some GTN spray, which is a spray in the little red bottle, which I've got a diagram up here. And if someone was really high risk, you could consider starting them on 75 milligrams aspirin once a day as well. So going over with patients how to use the GTN spray, you tell them that whenever the symptoms come on, they are to first sit down and rest, and then they take 1 to 2 sprays under their tongue, and then they leave it for 5 minutes. If their symptoms still haven't settled, they can repeat 1 to 2 sprays again, and then after a further 5 minutes, if the pain hasn't settled, they need to be calling 999 and getting an ambulance to take them into hospital. So, while the patient is waiting to be seen in the chest pain clinic, some investigations that you can arrange in primary care is number 1, check their blood pressure to make sure they haven't got high blood pressure. Number 2, you can get an ECG organised, but just to be aware, for some patients it may be normal. And you can get some bloods to check their overall health, so especially check their full blood count, their kidney function, their liver function, their cholesterol, or lipids as the test is known. Check their HbA1c, which checks for any signs of diabetes, and also check their thyroid function. So just a little bit of extra information. So some of the tests they may do in secondary care is either a coronary angiography, which is where they inject a dye and then take some imaging of the heart. And I've got some diagrams up here of what it looks like. They may do an exercise tolerance test where they hook you up to some monitors and see the activity of your heart while you're doing activity. Or they may arrange a stress echocardiogram, and I've got some more pictures of it up here. So moving on to management. So if a person has been confirmed angina by the chest pain clinic, then it's something that we can manage in primary care. So first of all, we address lifestyle factors, so making sure they quit smoking, they have alcohol within the recommended limits, make sure they have a healthy diet, especially keeping away from saturated fats, and making sure they're keeping active as well and getting that 30 minutes moderate exercise at least 5 days a week. Next, make sure they've got the GTN spray, which is used for the immediate relief if they get episodes of chest pain. And then next we move on to medicines to try and prevent them getting episodes in the first place. So first of all, it's recommended to put them on a beta blocker. So the commonest one we tend to use is one called bisoprolol. If they can't tolerate this, or it's not indicated in that person, then the next line would be to try a rate limiting calcium channel blocker. And the commonest one of this is diltiazem. So if their chest pain is still not controlled, and they're on the maximum dose of the first line medications, then second line would be, if they're on a beta blocker, then you would add in a long-acting dihydropyridine calcium channel blocker. And the example of this is amlodipine. And then other medications to consider are isosorbide mononitrate, nicorandil, ivabradine, or ranolazine. One thing to make you aware of is do not combine a beta blocker with a rate limiting calcium channel blocker. So that example is, do not give a beta blocker with medicines like diltiazem, as that can lead to what we call complete heart block, which essentially means we just turn the heart off completely. Now, if you've got someone on 2 medications and their angina is still not controlled, then it is recommended to refer them to see a cardiologist. And some of the interventions they may do in secondary care is either a percutaneous coronary intervention, or PCI as it's called. Some diagrams up here. So they put a little catheter through your artery all the way up to the heart. They get to the site of the blockage, and then that little catheter blows up to expand that artery, and then they'll leave a little stent there to keep it open. Or another thing they may do is, if there's quite a few blockages, they may just do what's called a coronary artery bypass graft, where they take a vein from another area of your body and then use that to bypass the area of blockage. And I've got some diagrams up here. So that's all the medicines to treat and prevent episodes of angina, but we also have treatments that we call secondary prevention to prevent some of the serious complications such as heart attacks, strokes, or other problems. So number one, you start a patient on aspirin, and this stops platelets grouping up to prevent clots forming and then that heart attack. So what we normally give is aspirin 75 milligrams once a day. Also offer them a statin, which is a medicine that lowers your cholesterol to stop it building up in the arteries. If they have high blood pressure, then treat this as per blood pressure guidelines. And also consider a medication called an ACE inhibitor, or you may commonly know them as such as ramipril, as these can have protective factors for the heart, and especially consider this for a patient if they have diabetes. Now, I'm just going to make you aware of unstable angina. So this is defined as new onset angina or an abrupt deterioration in previously stable angina that most commonly occurs at rest. So they're getting all the symptoms of angina, but just when sitting there doing nothing. Now, these patients need admission to hospital as they are high risk of progressing on to having a heart attack. Well, that's it for today's video. I hope you found it helpful and learned something new. Don't forget to like, comment and subscribe so I know that you're enjoying this content, and I'll keep making more videos. And if there are any particular topics you would like me to cover, then please comment in the comment section down below. Also, in the comment section down below, I've posted some resources for some e-learning resources so you can get some CPD points for your appraisal and just some general information to give to patients as well. I'm also on Instagram, so if you want to check me out on there, it's up here, it's GP Made Easy. Or if you prefer, you can contact me via email, and it's just up here. Well, I hope you guys have an amazing week, and I will see you in the next video. So we've just got back here my little props for today. So I've got a little blood pressure monitor, I've got a little stethoscope here for listening to the heart. I've got here, this is something to consider as well, it's a little portable ECG where you just put 2 fingers on, it links up to your phone and gives you an ECG trace. And I've just got a general book up about ischemic heart disease, which is another term for angina, or the narrowing of the arteries of the heart. But yeah, I'll see you guys in the next video.